Good afternoon, everyone. This is a webinar with English and Polish translation. So for translation, please go to the bottom of your screens where you find the interpretation icon and choose either the English or the Polish icon to listen to the interpretation. And we'll start in a minute.
Dzień dobry, witamy serdecznie podczas naszego webinaru.
Good afternoon, ladies and gentlemen. Welcome at our webinar. We have English and Polish interpretation provided, so if you wish to listen to the English version, please choose the interpretation button on the tab below, where you can choose if you want to listen to the Polish or to the English version. We are starting in just a moment.
Good afternoon, everyone. My name is Anne Stauffer. I'm Deputy Director at the Health and Environment Alliance. Sorry, I have now the Polish translation in the English channel. Yes. Let me start again. Good afternoon, everyone. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, an alliance of over 90 organizations from the health sector working for better health through a healthy environment. And it's my pleasure to welcome you all this afternoon for our webinar on better health through reducing nitrogen dioxide pollution in cities. I'm glad you all joined. I'm joined here by my HEAL colleagues, the colleagues Veronika and Jacek from our Polish office, as well as my colleagues from Brussels, Marianne and Elke. It's wonderful to see so many of you interested in this topic for today. Why are we organizing this webinar exactly on NO2 and on its health effects and efforts to improve health protection? This is because in recent years, the body of evidence on how NO2 can harm health has steadily grown. Health impacts range from short-term impacts on respiratory health to more severe outcomes, including hospitalization and premature death. These health impacts are very much on policymakers' minds at the moment, as next week, the European Parliament's Committee on Environment, Public Health and Food Safety will vote on updated, legally binding clean air limits, including for NO2. And actually today, later this afternoon, at around 3 p.m., the EU's environment ministers will publicly discuss their positions on clean air for health. So we thought, what better time than now, there isn't a better time than now, to consider the latest science on the health risks of NO2 and to speak about how NO2 impacts, or speak about NO2 impacts and concerns from a patient's perspective, but also, and that's important, sharing good practice on what we as members of civil society, as people concerned about protecting health, as residents in cities, can do to bring down concentrations of this health-harming pollutant. And I'm pleased that we have 3 distinguished speakers here this afternoon to help us shed light and guide the discussion. We have Professor Michal Krzyzanowski from Imperial College. We have Mr. Panagiotis Chaslaridis from the European Federation of Airway and Allergy Disease Patients Association. And we have Ms. Anna Gerometta from Cittadini per l'Aria in Italy. Today is actually the second webinar in the HEAL series on the healthy and clean city of tomorrow. And we're organizing this webinar series as we're seeing that the quality of life in cities is very much a topic of increasing importance for both policymakers, but also for all of us or for the people living in cities. And in fact, many decision makers have initiated policies and programs for clean, climate, and people-friendly cities. So based on the understanding that the quality of the environment is a major determinant of people's health, we're organizing this exchange here with all of you interested, engaging international public health and environmental experts. And we're especially looking at bringing this webinar series and this evidence to people in Poland, to civil society in Poland and the health sector in Poland. So with this, I'd like to hand over to my colleague, Weronika Michalak, for a short introduction in Polish.
Bardzo serdecznie dziękuję za ten.
Thank you very much, Anna, for this comprehensive introduction. And I fully subscribe to what has just been said, and I would also like to say that I welcome the fact that we co-organized this webinar with the Polish office of HEAL, and we've been present for over 10 years now, talking about the improvement of quality of air in Poland that translates into improved quality of life. I would like to thank all the speakers for accepting invitation, and without further ado, let me just stress how important this dialogue is right now, not only at the point of updating the air directive in the EU, but also looking at the first areas of the so-called clean transport zones in Poland. We hope that dioxide, nitrogen, and other nitrogen oxides are responsible for a big part of these issues. And now Jacek Karachon will take over. He's in charge of the technical issues. That's it. Thank you very much. Good afternoon, ladies and gentlemen. Hello. Thank you, Weronika and Anne, for your introduction. Just some housekeeping regarding our meeting today. We have interpreters with us, which means you can choose the version that you would like to listen to. There is a special globe icon below via Zoom, where you can choose either Polish or English. Now, in terms of asking questions during the meeting, unfortunately, you can't switch on the mic, but below, you will find on the bar the Q&A tab. So anytime you wish, feel free to enter your question there. And then this question will be either asked directly, or if we don't have enough time, the speakers can answer your question at a different point of time. If you have any technical questions, problems, please don't hesitate to contact us. You can also use the Q&A mode, and I will do my best to assist you. Now, the meeting, as you've seen, is being recorded. It will be made available via YouTube and other social media. So that means you can watch it also later or share it with other people. So without further ado, I'm handing over to Weronika.
Actually, back to me. So it's back to me for now starting the conversation on today's topic. And I'm very pleased, and a warm welcome to Professor Krzyzanowski for being with us this afternoon. He is a professor at Imperial College, and he's also the former head of the WHO Bonn Center on Health and Environment, and very much a leading expert in the field on the science on air pollution and health. And very pleased that you can be here with us and give us an update on the recent science on the health impacts of nitrogen dioxide. The floor is yours.
Thank you, Anna. I will try to share my screen. Hope you can see it.
Yes, it works.
Okay. Now I need to minimize your pictures. Yes. Okay. So I was asked to speak in Polish. So, but if you want to ask any questions in Q&A, you can of course ask in English. Będę mówił o dwutlenku azotu.
Good afternoon, ladies and gentlemen. I'm going to talk about nitrogen dioxide, its health impact, and I will also mention the fact that we need more stringent standards than the ones we have right now. Now, the first quite obvious question is, where does NO2 actually come from? How come it lands in the air that we breathe in cities? Or why does it make us concerned? Well, you can see the charts. It's of the European Environmental Agency based on reports from member states. And it seems that in all the states of the EU and in Poland, the dominant source of NOxes, because in fact the nitrogen oxide changes instantly into nitrogen dioxide. That's why we talk about nitrogen oxides. So the main source of that substance is the transportation. And that is the case both in Europe and in Poland. Another important source in Poland is energy generation, both the industrial energy generation as well as house generation. Other sources include agriculture and other sectors. So it's not that just one sector is to be blamed. However, that said, transport plays a big role, and the same goes for energy generation. In Poland, the emissions of NOxes have been showing a downward trend in the recent decade, fortunately, and they are below the national ceiling. That is the threshold that should never be exceeded. Still, as you will see in just a moment, even reduced emissions do contribute to very hazardous impact on the health. Now, the issue is as follows. The distribution of NO2 concentrations is very uneven, especially in cities. On the left, you can see here the average level of NO2 at communication sites, a bit lower in yellow. So these were traffic stations. You see the background urban area, so from locations a bit more far away from big roads and cities, whereas the rural background is 4 times lower than the value which are registered at traffic stations. That shows quite clearly that high concentration of NO2 is largely linked to traffic. On the right-hand side, you can see that in a more precise manner. Here you see average data from 2 measurement stations in Wrocław, in the south of Poland. What was measured here is between the years 2005 and 2018, NO2 concentration was measured at these stations, and these values were then made average per each hour of the day. And you can see here that during all seasons of the year, like in winter, spring, summer, and autumn, the measurements conducted at a traffic station are several times higher than those registered at the so-called background urban stations.
This is the peak of the morning and evening traffic. This clearly illustrates how much the nitrogen oxides level depends on transport in cities. When we compare sources of nitrogen oxides, they include petrol vehicles, but primarily these are diesel vehicles. When we compare the emissions from both types of vehicles, we have to remember that the regulations have become more stringent in the period of the last 20 years, and the standards that are currently effective impose minor fractions of the emissions compared to what was acceptable 20 years ago. This applies to the vehicles produced before 2005. The negative observation, however, is that during regular, normal vehicle traffic and normal operation, these standards are not observed. Even when we take modern vehicles, standard emissions exceed 10 times those that are stipulated in standards. This, however, is not observed in petrol vehicles because the issue and the problem can be solved more easily in the latter case. What about health impacts? In 2016, the American Environmental Protection Agency carried out a periodical survey of scientific data concerning short-term exposure relationship with respiratory and circulatory diseases. And the cause-effect relationship was determined as positive. Concerning long-term exposure, in the case of respiratory diseases, the link was determined as likely. In relation to circulatory diseases, the relationship was classified as suggested. In the period 2008 to 2016, the number of scientific evidence increased significantly. In 2016, it was already possible to say that the relationship between nitrogen dioxide exposure and these diseases was much stronger than a decade before. We can say there is a plethora of studies related to exposure to nitrogen dioxide. They have proliferated over the period of the last 20 years. Based on many studies, we can say that the relationships are stronger and better identified. You can see a number of results of systematic assessments of scientific studies. Based on several large studies, we can say that asthma, both in children and young people, as well as acute infections of the lower airways, are related to exposure to air pollution. The risk of acute infections of lower airways, such as pneumonia, are 20% more likely. It applies to children exposed to nitrogen dioxide concentrations higher than 10 micrograms per cubic meter. The data also suggest a relationship between COPD and long-term exposure. However, we need to remember that the data are not so unequivocal, and the relationship in the meta-analysis is not statistically significant. It is important to emphasize what studies on mortality and its relationship with long-term exposure to nitrogen dioxide reveal. We can see a clear relationship between all deaths and respiratory deaths. The meta-analysis of the risk reveals a higher risk in such deaths when higher concentration of nitrogen dioxide is observed. There was the so-called ELAPSE study published 2 years ago. It covered a population of over 325,000 people from several European countries. The people had been observed for a period of around 20 years in order to investigate the relationship between mortality and exposure to nitrogen dioxide. On the right-hand side, you can see that the death risk was increasing systematically throughout the entire range of nitrogen dioxide concentrations. All these concentration values in the 90% of the studied population was below the currently effective European standard referring to nitrogen dioxide concentration, meaning it was within the permitted value range. The risk increase was observed as around 9% per 10 micrograms per cubic meter. New observations were provided by a study on the incidence of diabetes mellitus and long-term exposure to nitrogen dioxide. The study was carried out in the United States on a population of over 41 million people aged over 65 for a period of several years. We can also see a statistically significant increase in the incidence of diabetes mellitus depending on nitrogen dioxide concentration. In this concentration range, that was the value which was permitted so far in the relationship between mortality and short-term increase in nitrogen dioxide exposure. This has been a topic of a number of studies. I'm here showing the results of a meta-analysis concerning data from 398 cities in 22 countries, and it applied to 68 million deaths. It means quite a convincing and reliable database. The meta-analysis also revealed a constant increase in the death risk on the days with higher concentration of nitrogen dioxide, regardless of the exposure level. It also applies to the currently permitted range according to effective standards. As you might know very well, the World Health Organization evaluated data from research until 2019 or beginnings of 2020. Based on the analysis of the data, the WHO issued the new recommendations as 10 micrograms for the annual average and the daily average, meaning 24-hour average, as 25 micrograms. It means they can be exceeded for 3-4 days a year. The annual average is lower than the currently effective standard. What about nitrogen dioxide pollution levels in different countries? You can see the results for various countries to the period up to 2020. The combination of light and dark blue means the median. That's why we should take them level into consideration. We can also see the concentration ranges. In Poland, it is much lower than the permitted concentration value, but in some places the value is exceeded. 1/4 of the inhabitants of Poland are exposed to levels exceeding 18 micrograms per cubic meters, meaning this value exceeds the WHO's recommendations twice. Summing up, we know that road transport is the dominant source of nitrogen dioxide in Polish cities. We know that the knowledge on the health impacts of nitrogen dioxide air pollution has increased during the period of the last 15 years. A relationship between mortality due to respiratory and cardiovascular diseases was identified with the exposure, and we also know that it does not depend on the impact of other air pollutions, and it also occurs at very low NO2 concentrations. Based on the data, we know that there is a likely relationship between incidence of diabetes and NO2 exposure. Nearly 3/4 of the Polish population live in areas where the WHO's recommendations of 2021 have been exceeded. We also note that the effective standards of air quality and the permitted values do not protect Polish and European population against harmful impact of NO2 on health. Thank you very much.
Thank you very much, Professor Krzyzanowski, for this overview, an excellent summary on the science on NO2 and health. I would like to encourage you to ask your questions in the Q&A, and this can be either in Polish or in English. We can respond to them in both languages. I don't see any questions yet. You're probably still thinking about your questions, so don't hesitate to put them in the Q&A as we go along with our next presentations. We definitely have time at the end. So now I would like to give the floor to Panagiotis Chaslaridis from the European Federation of Allergy and Airways Disease Patients Associations, who will provide us with the patient's perspective on NO2 and health. Over to you. Thank you for being here.
Thanks a lot, Anna, and let me just share my screen as well. Yes, there you go. I'm going to present a few aspects of the patient viewpoint on pollution from nitrogen dioxide. My name is Panagiotis Chaslaridis, and I am Senior Policy Advisor at the European Federation of Allergy and Airways Diseases Patients Associations. This is definitely going to be a challenge coming after Mr. Krzyzanowski, who so eloquently summarized the health effects of NO2 on respiratory health in particular. As mentioned, exposure to NO2 has been linked, and there's sufficient data by now with the onset of aggravation of asthma, both in children and adults, with a higher incidence and exacerbation.
We're going to interrupt you. We don't see your presentation.
We can't see your slides, indeed. Yeah.
I'm sorry. Okay, there you go. Am I sharing now?
Yes, you're sharing, just not in presentation mode. Yeah.
Perfect. So
yes.
Yeah.
No, there you go.
Perfect.
Sorry. Okay. So we're just mentioning that NO2 has been linked, exposure to NO2 has been linked to the onset or the aggravation of asthma, both in children and adults. And obviously, the aggravation maybe is intuitively easy to think for someone to think about. NO2 and generally other air pollutants as well are also linked with the onset of these diseases, contrary to the traditional thought that these are more or less genetic diseases, so showing the importance of the environment on affecting those diseases and triggering those from scratch. Then NO2 has been also linked with higher incidence and exacerbation of chronic obstructive pulmonary disease, reduction of overall lung function, but also infections of the lower respiratory system, as Mr. Krzyzanowski mentioned. All of these burden is typically associated with more and more the experience of more and more severe disease symptoms, but also increased hospitalizations and visits to the emergency room, as well as higher mortality, as the professor showed earlier. Now, a few things about where do we now stand on NO2. As mentioned before, it's considered to be among the major air pollutants. Both WHO and the European Union have either recommendation or specific standards addressing them. And this is because of the crucial health effects that this pollutant has on people. As mentioned, NO2 is primarily linked with the use of internal combustion engines, so with the transport sector, with the mobility, and that's actually why it mostly affects areas with heavy traffic, like urban centers. This is also having another crucial implication. It is a fact that it is a pollutant that is deeply embedded in our social and economic models, because mobility, since its inception, has been based on the burning of fossil fuels. Unfortunately, this has a direct impact on health. Obviously, today about 94% of the population lives in areas with NO2 levels above the WHO recommendations, which are health-based. And this is data from the European Environment Agency. Actually, today we're able to measure that NO2 is responsible for about 49,000 premature deaths solely as a pollutant in itself. But also many thousands of years lost due to disability. And it's important to see these data based on the pollutant itself, because as opposed to mixed to the synergistic effects of NO2 with other major pollutants, like particulate matter, for example. In the meantime, we should keep in mind that NO2 also poses a risk as an indoor pollutant, as gas stoves, oil stoves, but also the burning of solid fuels for heating also emit significant levels of NO2. Now, an important aspect is that nitrogen dioxide is a key example of a pollutant that generates inequalities. It is within a society and an economy, I mean. This goes well beyond the very basic inequalities based on the health burden that pre-existing patients with pre-existing diseases have to face. Which by definition leads to them experiencing heavier disease burden. That's because air pollution from transport has been found to be higher actually in deprived urban areas, such as next to busy roads and next to industrial sites. And this has a clear economic aspect too, as less privileged communities are more likely to live in urban areas with less access to green spaces, or in houses that are less protected from outdoor and indoor pollution, simply because these communities cannot afford a better location for their homes. Then patients themselves are often forced to adapt their behavior as pollution limits their choices. And this a key example from the pollution from the transport sector is the avoidance, for example, of highly polluted areas and streets when conducting our daily activities, such as walking or exercising, for example. Finally, that leads me to some thoughts about what are the main asks of patients, of chronic respiratory patients, in view of the ongoing revision of the air quality framework of the European Union. We have consistently been asking for a very strong focus on the health burden of air pollution on health. The focus on the relative impact of various polluting sectors, and transport is among them, but also the need to address the needs of specific groups of the population that are more vulnerable or sensitive. In further detail, we think that it's high time for a full alignment of the EU standards with the WHO recommendations for nitrogen dioxide by 2030 at the latest. And this does not only affect NO2 actually, but also the other major pollutants addressed by the European Union directive. We also think that it's absolutely important to ensure better real-time information on pollution that is harmonized across the European Union member states based on two major aspects. One, solid thresholds triggering public information to the people, but also national air quality indices based on harmonized information across the EU. Another key aspect is the access to justice and compensation for health damages. These are new elements in the proposal of the European Commission, and we need to see strong commitment by the European Parliament, but also in the discussions with the Council. And finally, and probably the most important in order to allow us to make better policies later on, is an overall shift of mindset. We need to keep in mind that like in other aspects of pollution, in transport too, changing the individual behavior is not always up to the individual choice. We need to have the policies, the context in place, allowing and facilitating this transition, because otherwise it is not possible to move for the individuals to move to these mindset for a greener transport, for example, both in economic terms, but also in terms of the mindset itself. So we really see a huge role for policies there, for actually forward-looking, ambitious policy making in order to enable this shift of mindset for everyone, both collectively and individually.
Thank you very much for this presentation and for sharing your perspective from the patient's view, and for highlighting especially how NO2 and other air pollutants impact patients' lives. For example, when it comes to having to think when to go out, or which roads to take. Plus the fact that you mentioned that living close to a busy road unfortunately has very much a threatening and strengthening effect. You ended up with talking about what needs to be done, which is actually a perfect link to our next speaker, which is Ms. Anna Gerometta from Cittadini per Aria from Italy. Cittadini per Aria is an NGO of people committed to defending the right to clean air. And Anna, you will now present to us on what can be done, what needs to be done to tackle NO2 pollution in cities. Over to you and welcome.
Yes, can you hear me?
Yes, we can hear you.
Good. And can you see my presentation?
Not yet, so let's check on that.
Oh,
yeah.
Okay, so I go back, yes, because I definitely need to share my screen. That's a good option. Okay, so can you see it now?
Yes, just not in presentation mode yet.
Yes, I will. Oh, oops. Okay. Okay, so
yes, perfect.
yes,
now yes, we
okay.
can.
So yes, we are an NGO from Italy, and we've been actually starting to work on pollutants, specifically on NO2, because our cities in Italy are very polluted, very much polluted by traffic. I was looking at the data just to give you that were presented previously, just to give you an idea. In Italy, most of the times we have more or less 60% NOx coming from traffic. Our cities are very, very full of traffic, and that is why when in 2015 Dieselgate started, we decided that we had to do something to actually address the issue that was not very well known, because, as you know, when Dieselgate started, the problem was exactly that the emissions of nitrogen oxides that were coming from cars were really neglected. It isn't, everybody was talking about particulate matter, and nobody was really talking about nitrogen oxide. But then with the Dieselgate, we realized that cars were not, and car makers were not really doing what they were promising. Their engines would turn off the pollution control systems. And that really made the situation very serious in cities, because the levels of nitrogen oxide emissions from cars were 5-6 times the legal limits of the specific cars. And actually that was very well proven in Paris, for example, that did a very interesting remote control campaign, which is a campaign that is a very technical one that is being done with very sophisticated machines, and they monitored the cars in Paris for a number of days and measured thousands of cars in a few days, and they realized that even Euro 5 and Euro 6 cars had 5 or 6 times the emissions of nitrogen oxide that compared to what was the legal standard that they should have had. So, so this is really a problem that we are actually facing still now, because European governments should have gone back to car makers to request them to address the issue on older cars until Euro 6 C, which is the standard, the latest standard to which, let's say, the Dieselgate issue applies. And that's how really we decided to try to do something that would highlight this issue, would teach the citizens and the policymakers that there was something else that we were breathing on top of particulate matter in our cities. And we discovered that there was this campaign that was going on in Holland, in the Netherlands, that was hanging a small diffusers, NO2 diffusers, which are very small tubes. Very, I'm not sure I have one here, but you will see it in the pictures later on. That can really be very reliable in practice to measure on a monthly basis the level of NO2 in the location where you have placed it. They are little tubes, they're very cheap usually, and you take away one of the two tops, and the tube will measure NO2 in the location where you've put it for a month. And so at the end of the month, you give it back to the laboratory and you receive the monthly concentration. That is a system that can be very well applied by NGOs in Poland, in everywhere. And it is being used actually by NGOs to engage, to activate, and to measure, to inform, in order to make sure that both citizens and policymakers are made well aware of the issue of NO2. When we started, as I mentioned before, we started with basically, I think we had 150 citizens participating. And the first map was done in Milan in 2017. And you can see all these dots are actually, the levels. You can see that many of them, as you can see from the coloring here, measured more than 70 micrograms of NO2 during the month of February. That was the period of time when we did it. And so you can understand how serious the situation is in Milan, which is in the Po Valley. And with the help of the researchers, we managed to have the data from the passive diffusers calibrated with the official monitoring station of NO2. And with that, we also had epidemiologists analyze with the system of artificial intelligence what was the estimate of premature deaths resulting in Milan from the exposure of the population to a quota exceeding the legal limit. I'm a lawyer, so I really wanted the mayor of Milan, that you can actually see here in the picture. I wanted him to be very much aware of the fact that due to the exceedancy of the NO2 in Milan, that was an additional burden of premature deaths to the city that he had to really address. And that actually happened because I'm sorry, I should go back, because in very few weeks, he declared that he was adopting a new low emission zone in Milano that was kind of planned, but for a totally different reason. And he turned it into a low emission zone. It took a while before then it got into, let's say, really working, but still it was quite an achievement to have to reach that objective. And the same thing we did in Rome the next year, and the mayor of Rome also there declared that she was going to adopt a new LES, because we showed her that as a result of the exceedancy of the legal limit, there was a burden of premature deaths. And we also showed to her that if we took as a counterfactual the 20 micrograms level, which was at the time the data that was coming from a WHO European, let's say, analysis of the burden. In Rome, there were 2,634 deaths every year. So that was an enormous burden. And also the mayor of Rome decided that she had to do something. Now, we went on, and in 2020, we closed the monitoring, and just 1 week before Italy was completely shut down for COVID. And we monitored again Milano, and which you can see here how dark it is, and Naples, where you can see, you know, again the traffic way, and also in Naples you can also see the shipping emissions on the coast, and Rome, which had again a new monitoring, and you can see that again we were helped by the researchers to analyze the burden for the 3 cities, where it came out that basically in Milan, more or less 11% of the overall mortality can be attributed to NO2 exposure. In Naples, it was 6.6%, and in Rome, it was 6.2%. So these are data that, you know, when you give them and when you have researchers that are so, you know, generous to work with you, they really make a difference. So the power of citizens really working with the researchers is super strong. What happened, and it was beautiful of our campaign, that as we started in 2016, making the first measurement campaign, we had other NGOs all over Italy decided that they wanted to do it. So we had Torino, where they were very much scientifically strong, and they started doing the campaign, you know, in connection with us, but totally independently. The same in Bologna. They did it on their own, and they have kept on doing it all these years, like we did. And so what was nice that in the end, we decided that we wanted to all celebrate the commitment of the citizens. So we printed out the posters to show the levels of NO2 that we measured in front of the schools in Rome, Brescia, Milano, Bologna, Torino, and Naples. And we had the children do a flash mob all over Italy. We also arrived to a very important museum in Milano, where we had our signs shown. And now these same posters are being used in the schools of Milan to ask for school streets. Because of course, you when you eliminate traffic from streets around the schools, one of the characteristics of NO2 is that it reasonably drops quite fast and geographically, closing a street can actually reduce a lot of the NO2 component. We then used the 2020 map to actually create a map that was interactive, where each citizen could actually insert their address and identify the estimate of the level of NO2 at their own address or at a school. And with the help of the epidemiologist, we indicated point by point what was the health impact for chronic exposure to the levels that we measured, that were measured in each address in Milan, both for children, risk of additional asthma, and also for acute respiratory infections. And for ordinary addresses, we indicated the increase of mortality risk and of ischemic heart disease events. Now, this is something that is very, what this project really made us understand is that it helped us actually liaise with the policymakers and local administrators, because they do need, citizens to be engaged and to support their policies. And so as the years went by, we really had an increase of connection with the policymakers that were waiting for our data, like it is now. We're about to publish the new maps of Rome and Milan. Now you don't see the colors because they are completely blocked, but we starting from 150 in Milan, this year we've had 1,500 people participating, 500 in Rome and 1,000 in Milano, which is definitely a very good data. We went out to the metropolitan area of both Milano and Rome. As you can see, we even have monitoring points near the coast of Rome. So, and in the fall, we will also be working with researchers to have citizens wear portable NO2 passive diffusers tubes, and at the same time participate in a project testing their mental readiness every day, and this will happen in the fall this year. And so we're very happy if we will be able to contribute to increase of knowledge also versus this theme. We couldn't do without researchers, as you can see, and without, and participating in a project is really very important for us and for citizens. So we've been doing this all time long. We've had, mothers with children going to school and being followed by researchers to monitor and create paths to understand where are the and what is the exposure of children when they go to school. And this mountain that you see here, it's not a mountain, it's a paper handkerchief with which we use to clean the exhaust pipes of the cars in Milan with the university students, and we actually ended up with very good data to show, the different levels of pollution coming from the different levels of cars, and it was quite surprising. But we realized also that, for example, that motorbikes are super dirty, which it's not so easy to think of, and that we definitely have an enormous amount of cars in our cities that are very, very dirty. So I think that the takeaways is that citizen science really enables representation of the problem to policymakers and to the public, and that is really very important. Citizen scientists themselves, in participating to the project, acquire awareness and understanding of the issue and support research with additional knowledge, because our researchers would never have had so many data from Italian citizens if we hadn't started this project. The citizen science is popular, and that because, you know, all the co-authors are so many and they spread the word so much. And also it gives you as an NGO and as citizens an opportunity to continuously use the data, to show the data to your own policymakers. And it is a useful tool for policymakers to have a backup for enhancing and improving policies. And it is a lot of fun. So I frankly strongly advise it. You have to be very motivated, but once you start, it's almost impossible to stop. And thank you very much. And I'm here for any questions you might be interested in.
Thank you very much, Anna, for this really inspiring and encouraging presentation on showing what is possible, and yeah, amazing to hear that so many people have participated now and are participating now in gathering this knowledge and this evidence. And it also very much shows that people want clean air everywhere, be it in Poland, be it in Italy, be it in Spain. It is very much a movement across the European Union on people calling for clean air. We've reached the end of the time. At the same time, we have a question in the chat for Mr. Krzyzanowski, so I'm handing over to you as there was a question on the signs.
Tak, było pytanie dotyczące...
Yes, there was a question concerning the risk factor. 1.09, that was the risk factor, which was estimated in the ELAPS study for mortality, for general total mortality. I would like to remind you that in the 24 other studies which were included in the meta-analysis, it was 102, meaning much lower than in the ELAPS study. And it was also for all-cause mortality. That's the answer to the question in the chat.
Thank you very much. I can add on a brief question on that, because personally I think the science speaks for itself, and what you presented at the same time when Heal and others speak to policymakers, there are many questions around the science and the questions about the certainty of the science. I can say this also for a national level, for my home country, for Germany, where we very much encounter this, and especially relating to NO2. We get questions, yes, you know, aren't these all only studies done in occupational settings, or isn't this only looking at indoor settings? So how sure can we be of the evidence that we have?
The comprehensive assessment of the evidence based on various types of studies from clinical up to epidemiology has increased tremendously. We have the assessment done by US EPA from 2016. US EPA is working on a new assessment, and the amount of data which appeared in the last few years, I would say 10 years, is enormous. Researchers started to look at NO2 and tried to assess the NO2 impact independent of other pollutants. And this research is confirming that NO2 indeed has an impact, especially on respiratory diseases, but also on some other diseases like diabetes, which is a new observation, which has been not seen, was not looked at in previous studies. So we are discovering, we are confirming all the results with new studies, and we are discovering new associations in new studies. So we are more and more certain about the causative role of NO2 in various health problems.
Thank you very much for this answer, which I think is also a very important message to hear for our policymakers. I mentioned at the beginning of this webinar that we're at a key moment here, as indeed we're a week away from the European Parliament's Envy Committee deciding on stricter clean air standards. And I think from everything we heard today, when it comes to the science, when it comes to the need of protecting all of us, but especially those which are most at risk, and when it comes to knowing and hearing that people across the EU want for clean air, I think it's very clear that a call from HEAL, but many health groups, civil society engaged in this endeavor. It's very clear that we need to see a full alignment of the EU's legally binding clean air standards for NO2, for PM, and other pollutants with actually what the science says, because we need this for our health, and we also need a strong enabling framework with that. And we invite all of you who are not yet active and who want to be more engaged to join HEAL and the other organizations here in this call to highlight the need to fully align and to have much stricter and more health protective EU clean air standards and a framework with your decision makers, be this at national level, be this at the EU level. You can contact us for any further information, opportunities to become engaged. And with that, I want to thank all of you, all participants, for being here this afternoon. I want to thank our 3 speakers. It's been really wonderful to have you with us, and thank you very much for your rich presentations and interventions. I would like to thank the HEAL team who's helping me in organizing this webinar series. Thank you very much. And last but not least, I'd like to thank our translators, Dorota and Sonia, for being here and for ensuring that we can talk about this issue across borders. I would like to invite you to the third and last in our webinar series, which will happen next Wednesday, not next Tuesday, because next Tuesday is going to be the vote, but it's going to be next Wednesday at 1 o'clock. And this time we'll be speaking about the health and mental health benefits of green spaces in cities, another important and also upcoming topic that we see very much of concern. And yes, stay tuned also for a briefing that we will soon launch, a briefing written by you, Mr. Krzyzanowski, on the health effects of NO2, which will be available in Polish and English and will be launched in the next days. And if you have any further questions, informations, don't hesitate to be in touch. Thank you very much and have a good afternoon.
Thank you. Goodbye.
Bye.
Thank you. Have a good afternoon.
Thank you. Dziękujemy bardzo.
Thank
Do
you. Good
zobaczenia.
afternoon.
Thank you very much and goodbye from the interpreters.